The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. I'm Kim Bischoff, the Executive Director of the NF Network, and we would like to welcome you to our webinar series. This evening, we have 85 people registered for this webinar from across the country. These webinars have proven to be an excellent way for the NF Network to reach individuals across the country. This webinar is being recorded and will be available for viewing on the NF Network website. The NF Network is very active in our advocacy work in Washington, D.C. to secure federal funds for NF research. Through this process, we've been working with Katie Van Landingham with Van Scoyoc Associates, located in Washington, D.C. I would like to introduce you to Katie, who's joining us tonight. Hi, Katie.
Hi.
Hi. I went to Katie to find out more about this Affordable Care Act and, if funded, how it could affect us. Katie did some research and she found Cheryl Fish Parcham, the Deputy Director of Health Policy at Families USA. Families USA is a national nonprofit, nonpartisan organization dedicated to achieving high-quality, affordable health care for all Americans. This evening, we are very fortunate to have Cheryl to help us learn more about the Affordable Care Act. After Cheryl's talk, we'll have a limited time for questions and answers. There is a box at the right of the webinar control panel which will allow you to type questions. I'll read the questions as time permits. Captions Unlimited is providing a captioning stream on the side of your screen. It will show up on your screen automatically. There's nothing you need to do. To write a question to be read aloud to Cheryl, just click on the question box located at the lower portion of your webinar control panel. To remove the webinar control panel from your view of the screen, click that orange rectangular button with an arrow at the top portion of the control panel, and this may be necessary to have a complete view of the presentation. And now I would like to introduce to you Cheryl Fish Parcham. Welcome, Cheryl.
Thank you very much. So I'm glad to talk to you about the new Affordable Care Act protections. And October 1st is an exciting day because a lot of changes take place. So can we go ahead and advance the slides? Can you go to my next slide, please? I apologize, we're having a little bit of trouble getting the slides to work, so hopefully it will advance in a moment.
There it goes, Cheryl.
Oh, I'm not seeing it, but I'll just go ahead and talk about October 1st that enrollment begins. And at that point, individuals can enroll in new marketplace coverage. And in some states, small businesses will also be able to enroll October 1st, and in some states they'll enroll a little bit later in these new marketplaces that we're going to talk about tonight. Can you go to the next slide, please? And I can't see the slides advancing, but can the audience now see that the next slide says 2014 Better Access to Coverage?
Yep, that's the screen that I have on here.
Okay, great. So in 2014, the marketplace coverage will actually begin. Right now, people are signing up for coverage beginning next week. And it will take a little while in that they're given a few months to sign up, and then their coverage will be effective in January 1st, 2014. There are other changes that also take place January 1st, 2014. One is that plans will no longer be able to deny people based on their health status or pre-existing conditions. And you may know that that's a big problem right now, that people have pre-existing conditions often can't get any coverage right now at all. And so in 2014, they'll be able to get coverage, and not only will insurers not be able to deny them, but they also won't be able to say, we're going to cover everything except your pre-existing condition. Premiums will only be able to be based on some things. There will be no premium hikes that are based on pre-existing conditions, health status, gender, or occupation. So, and that takes those last changes take place about pre-existing conditions, whether you're in the marketplace or not. And I'm going to talk about the new marketplaces on the next slide. So can we go there?
Okay, hold on just a minute, Cheryl. Let's see. Okay, now I'm on the screen that says new marketplaces.
That's great. So the new marketplaces are where you can apply for private insurance for yourself or your family. You can also apply for premium credits and cost-sharing assistance, that is help from the federal government that will lower your premiums. You can also apply for Medicaid or the Children's Health Insurance Program. And the good news is that there is one application that will screen you for all of those things. One thing that's especially important about these new marketplaces is that when you buy private insurance, you are comparing apples to apples. You may know that right now it's very difficult to understand what different insurance companies are offering, and the marketplace is designed to make it easier and make you be able to compare different plans along the same measures. So let's go to the next slide.
Okay.
To find your state's marketplace, you'll go to healthcare.gov, and that's the federal government's website. The federal government will be running the marketplace in a number of states. In some states, states are setting up their own marketplaces, which you might also have heard of as exchanges. Those are the same thing, marketplace and exchange. But the great thing is that healthcare.gov is going to also provide links to the state exchanges. And that's very helpful because we all know that there can always be scam insurers that set up sites that make you think they're the government when they're not, or make you think that they're the legitimate marketplace when they're not. If you go to healthcare.gov, you can have confidence that you're getting to the right place and to a legitimate insurer. So let's go on. So on the new marketplace, you can fill out one application, as I mentioned, and be screened for each health coverage program. You can be screened for private insurance that you're buying on your own. Small businesses can shop for insurance for their employees. Filling out this single application, if you're buying coverage on your own, will also screen whether you might be eligible for Medicaid, CHIP, or premium credits that lower your monthly premiums. When you apply online, it's a fairly easy application. You just have to remember that if you want this extra help paying your costs, you have to fill out the application that says help with healthcare costs. If you fill out just a short application, you'll be buying coverage on your own without this extra financial help. The online system is going to try to verify your information electronically. For example, you'll list your income if you want the extra financial help, and it will check records such as your tax returns or wage databases or unemployment databases to try to determine whether what you've reported seems to be in the ballpark of what the government knows. This will minimize the documents that you have to provide. And if you've ever filled out a financial aid form for colleges, it's the same kind of concept. The online system will try to verify information for you, and if it can, you don't need to provide any extra documents. So it should be an easy application process. Let's move on. Next slide, please.
Okay. Ways to apply.
Yeah, so now I can see these now, so thank you. So on ways to apply, you can apply online, and that actually is going to be the best way to apply when everything is up and running, because it makes the application process easier. It makes the application be able to check things electronically for you. But if you don't have access online, you can also apply in person, by phone, or by mail, and those four methods will be available in every state and also on the federal exchange. You may be used to in-person interviews that some states require for Medicaid or for the Children's Health Insurance Program. There are no in-person interviews required any longer. So let's move on to the next slide. There's also help available when you are trying to select a plan or when you have any questions about filling out the application. And there are four kinds of help. There are navigators in some states, assisters in other states that are trained to assist you. They're often in community-based organizations. And the names of navigators and assisters will be listed on the Marketplace website. The call center will also have the names of the navigators and assisters in that particular state. There will also be a chat line in many marketplaces where you can ask questions online, and there will be a call center there which is actually already up and running and can take calls 24 hours, 7 days a week. Let's go on. So the kinds of coverage that are available with financial help, there is sort of a continuum of help. If you're a family of 3, and you are in a state that has taken the federal option to expand the Medicaid program, you can get Medicaid as a family of 3 with income up to $26,000 a year, and Medicaid does not charge premiums. Let's take that same family of 3, and now let's say that it's making up to $78,000 a year. Then that family of 3 can go to the marketplace and get tax credits or financial assistance, they're the same thing, to make premiums affordable. It lowers their monthly cost of premiums, but they'll still be paying premiums, and the amount of premiums that they pay will be based on their income and the plan that they choose. And then if they make more than $78,000 a year, they can go to the marketplace, and there are the new protections, but they'll be paying directly for private insurance the full cost. So that kind of gives you an idea of the continuum. Let me go back to the Medicaid part for a minute. You may have heard on the news that many states are expanding Medicaid so that it will serve families with income up to $26,000 a year, and it will also serve adults without children. Some states have not taken up that federal option, even though the federal government will pay virtually all of the cost of expanding coverage. Some states have been stubborn and have not taken up this option. In those states, you'll be able to get premium credits, that family, if their income is over $19,500, but if it's below that amount, they may not be able to get Medicaid or premium credits, and that's why it's so important that we encourage state governors and legislators to take up the Medicaid expansion. Let's go on. So let me talk now about financial help and these premium credits that lower the monthly costs of your premiums. This is it's called a premium credit because it's actually a tax credit, but it's not like any tax credit you've ever seen before. There are different ways that you can get these tax credits. And one of them is that you can get them in advance every month, and in that case, the federal government will actually be paying your plan the difference between what you're supposed to pay based on your income and the full cost. So in effect, it's really just a lower premium for you every month. You can get the premium credits if you meet a few qualifications. Those qualifications are that you don't have an affordable offer of coverage from an employer. That is, either your employer is not offering you coverage at all, or they're offering coverage without hardly contributing anything to the cost, so that your costs are still more than 9.5% of your income. You also can't have Medicare, CHAMFA, or TRICARE, and you wouldn't be able to have Medicaid either, because if you were eligible for Medicaid, you would be placed in the Medicaid program instead of the premium credit program. So there are 3 ways you can take these premium credits. As I mentioned, you can take them on a monthly basis so that they lower your monthly premiums each month. You could also wait and say, no, I'm going to pay my full premiums right now, but I'm buying a marketplace plan, and then at tax time I'm going to file to get my premium credits back like I would get any other tax credit. Or you can elect to take part of your premium credits on a monthly basis and part of them later when you file your tax return. At any rate, you'll be sort of made whole when you file your tax return. If the government's paid you too much, you'll have to pay them back. If the government's paid you too little, they'll pay you some. The reason it might be a good idea to take some now and some later is because if your income goes up, the amount of help you get is based on your annual income. So if your income goes up, you'll be eligible for less help from the government. And so sometimes people want to hedge against having to owe money at tax time, and they do that by taking part of their credits now and part of them later. But that all is really your choice, and there will be a calculator on the websites that help you sort of look at what would happen if your income was at different levels. Let's move on. So who qualifies for premium credits? The rules are that you have to be lawfully residing in the U.S. You can't be incarcerated. You can't be in jail or prison following a conviction. You can't be offered affordable, comprehensive job-based coverage. So I talked about affordability. The comprehensive-ness has to do with if your job-based coverage is so skinny that it's really meaningless, it's really not covering hardly anything, you'll get a notice saying that your plan doesn't meet minimum value, and that's the word for really lousy coverage. So if it's not providing minimum value, you could still shop and get premium credits. As I mentioned, you can't qualify for a government program. If you qualify for Medicaid, CHIP, Veterans Health Benefits, or Medicare, you would get those instead of private insurance with premium credits. And the income limits you'll see there are between 100 and 400% of federal poverty line. And this is adjusted gross income. So if you're close to these amounts, it's still worth applying to see whether you might be eligible. Let's move on. So one caution is that tobacco rating can add to the cost. So if you're a smoker, or if unfortunately plans can still charge additional premiums to tobacco users in most states. They're allowed to charge as much as 50% more than the standard rate to smokers, and they would look back 6 months for history of smoking. States have the option to do away with that, but only some states have. So that's just a caution to you. If you've stopped smoking, you certainly want to tell the plan that you've stopped smoking so that you can do away with this rate up. Let's move on. Another great thing about the marketplace is that you'll have certainty about what is covered. All the plans have to cover essential health benefits, and actually if you buy individual coverage or small group coverage outside of these new marketplaces, they also have to cover these essential health benefits if you're buying a new plan. If you have an old plan that you're renewing, they might not cover all of these things. And there are a few things on this list that that are sort of new things that a lot of plans haven't covered in the past. Maternity care was often left out in the individual market. Mental health and substance abuse services were often left out of private plans. And habilitative services, those are services that are designed to help someone who was born with a congenital problem recover from that problem or do better in that problem. Those are now covered, and oftentimes plans have not covered this in the past. Let's move on. So what you'll see in the marketplace is that plans are going to be offered in 4 metal levels, and these metal levels are sort of an index for you about how generous is the plan's coverage. The bronze are the least generous, the platinum plans are the most generous, and gold and silver are somewhere in between. Now, as I mentioned, all the plans are going to be covering pretty much the same benefits. Those 10 benefits that you saw in the last slide, all the plans have to cover those. But these metal levels give you an index of how much you might be paying in premiums, co-payments, and cost sharing. If you've ever looked at plans, you might see that one might have a $500 deductible, another might want to have a $1,000 deductible, one of them might charge you 20% co-insurance, another might charge you $10 co-payments, and you sort of might wonder, well, when I add all those up, which plan is the most valuable to me? The metal levels are designed to tell you that. It's an index that lets you compare plans and say, okay, all the bronze plans cover about this much. It's about 60% of an average population's medical costs. Silver plans cover about 70% of a population's medical costs. So that's a good way to start off weeding out your plan choices. Let's move on. So this is just kind of showing you the same thing. There's bronze, silver, gold, and platinum plans. I forgot to mention there are also catastrophic plans that have a very high deductible, and only certain people can buy those plans, young adults and people who have a financial hardship so that they can't afford anything else. But be wary of those plans because they have a very high deductible, and if you can't afford to get care in the meanwhile, they may not be a good deal for you. Let's move on. So I just want to kind of explain again how these cost sharings work so that if you're looking and comparing plans, what the different things are that terms you might need to know. One is the deductible. And the deductible, you pay all of your health care costs except for preventive care until you meet a plan's deductible. At the point that you've reached the deductible, you and your plan share the health care costs. You might pay co-payments, you might pay co-insurance, which is a percentage of costs, and you keep paying them until you reach an out-of-pocket maximum. When you reach the out-of-pocket maximum, your plan pays all of your health care costs as long as you stay in network for the remainder of the year. People who reach the out-of-pocket maximum are people who have high health care costs, like high costs for drugs or high costs for a hospitalization. Not everybody will reach that out-of-pocket maximum. Let's move on. Some people will be eligible for extra help, and it's called cost-sharing reductions, which is essentially a discount on their cost-sharing. So that might mean that they will have less in an out-of-pocket maximum, or it might mean that their deductible and co-insurance might be less. And in order to get that help, extra help, you would have to be enrolled in a silver plan, and you'd have to have income below 250% of poverty. So when you fill out the application, it's going to tell you whether you're eligible for this cost-sharing assistance. If you are, be sure that you look at the silver plans. Those will be most valuable to you. Let's move on. We talked about Medicaid a little bit earlier. Medicaid in many states is going to cover adults up to 133% of the poverty level, even if they don't have children. And it's very important to advocate that all states do this. You don't even have to have a permanent disability if you qualify in many of these states. Let's go on. In Medicaid for people with disabilities is going to change a little bit for some people. In some states, it covers more services than Medicaid for other adults. If you apply through the marketplace, the main thing you need to do is indicate that you do have a disability. If you do, it's going to ask you, do you need help with different activities of daily living? Do you need long-term care? If you do, be sure to check those boxes, and they may ask you to fill out a supplemental application to see whether you're eligible for the extra benefits that people with disabilities sometimes receive. Let's go on. December 15th is the last day to enroll in the marketplace if you want your coverage to start on January 1st. And you would have to both enroll and pay a premium by December 15th. So it's good to start looking at plans now because you'll want to go ahead and, excuse me, I have a pop-up box telling me that my audio performance may be causing problems. Are you able to hear me still, please?
I can hear you just fine.
Okay, thank you. Okay, well, I'll continue then. So the last day to enroll in the marketplace if you want coverage to start on January 1st is December 15th, and you'll need to both enroll and pay a premium by that time. Medicaid coverage you can continue to apply for throughout the year. You can continue to apply for marketplace coverage longer too, but it will start later, and I'll go back to that deadline in a minute. So let's go on. Next slide, please. So January 1st is the date that there's no more pre-existing condition exclusions for adults. There are no higher premium prices based on health. Coverage begins in the marketplace. Individual and small employer plans cover the essential benefits. It's also a date that if you start going without coverage for 3 months or more, you might face tax penalties. So you do want to be insured by that time. Next slide. So the requirement to have insurance is called individual responsibility, and starting in 2014, each individual has to have minimum essential coverage, which most in health insurance is minimum essentials coverage, or they have to qualify for an exemption, or they'll have to make a payment when filing a federal tax return, and the payment is called the individual shared responsibility payment. It's essentially a fee for going without coverage, and we'll get into that in the next slide. So the penalties for going without coverage are $95 for adult, $47.50 for a child, or up to $285 per family, or it might be 1% of the family income that's above the filing threshold, whichever is greater. So it's a modest penalty, but it still is a penalty in 2014. In 2016, that penalty rises. In 2015, it also rises, and you can see the penalties there. You would not be penalized for a gap that lasts less than 3 months in a year, and you also wouldn't be penalized if you had some certain reasons for going without coverage, and we'll get into that in the next slide. Next slide, please. So some people are exempt from the responsibility, and the people who are exempt include people who have a coverage gap of less than 3 months, people who've had a financial hardship so that they, for example, couldn't afford a basic necessity if they paid for health insurance. If you have a low income so that you don't even have to file taxes, you're exempt. If premiums would be more than 8% of your income, you're exempt. If you're incarcerated, not lawfully present, Amish or other religious sect that is opposed to health insurance, a member of a healthcare sharing ministry, or an Indian tribe, you're also exempt. Some of those exemptions you need to actually file and ask for a certificate of exemption from HHS in order to get it at tax time. So especially if you have a financial hardship, you want to talk to the marketplace now about how to certify that. Let's go on. March 31st is the time that open enrollment ends for the year in the new marketplace. So you definitely want to enroll before the end of March 31st, or you may not be able to get in at all until 2015. But there are certain exceptions. For example, if you've had a major change in your life, such as job loss or marriage or a new child, or you've moved, you might still be able to enroll outside of the open enrollment season. So be sure and talk to the marketplace if one of those things happens to you during the year. And remember that you can still enroll in Medicaid throughout the year. Next slide. So I think that's it, except I just want to reiterate that in order to get all of this information and to enroll in a plan, go to www.healthcare.gov, and that's the way to find the plans in your marketplace, in whether you're using the state or the federal marketplace, and you'll find a ton of other information there that kind of goes over some of the points that I've made today. I think that's all I have to start with, and I'd be glad to answer questions.
Well, thank you very much, Cheryl. I'll give people a chance to go ahead and type their questions in. But I have one while we're giving them an opportunity. One of the things that you said is if you don't have affordable coverage from an employer, what constitutes affordable and comprehensive coverage? How can you find out that information on some of these websites that you had talked about?
Sure. So when you apply for coverage, you're going to there's an employer coverage tool that you can take to your employer to fill out that will help you provide that information to the marketplace and help you fill out a marketplace application. But the definitions of affordable, unfortunately, are not very generous to you. If the plan costs you more than 9.5% of your income for the employee's coverage alone, then it's considered unaffordable and you could shop on the marketplace and get premium credits. Unfortunately, they only look at the cost of the employee. They don't look for employee coverage. They don't look at the cost of family coverage in determining that. The other time, the other test for employer-based coverage is whether it meets minimum value, whether it's a really skinny plan that covers very, very little, or whether it covers coverage almost like the bronze plans on the marketplace. And you'll get a statement from your employer. The plan has to tell you whether it meets minimum value. There's a new document called the Summary of Benefits. You might have seen it in the last year or two. It's a quick summary of your coverage, and on page 4 of that summary, it also tells you this plan does meet minimum value or this plan doesn't meet minimum value. If it says no, it doesn't meet minimum value, you can shop on the marketplace and get premium credits.
All right, thank you. Now there's questions that have rolled in here.
Okay.
This one is from Lisa. What if your employer does not offer you insurance and you don't make enough money to pay monthly payments?
Okay, so you might qualify for Medicaid. It's certainly worth applying on the marketplace to see whether you will qualify for Medicaid. You might be able to, if you don't qualify for Medicaid, then you may have to make some monthly payments to get insurance, but they'll be much lower than the kinds of payments that you've been used to. It might be, for example, 2% of your annual income that you would be paying for health insurance premiums. If you can't get Medicaid and you can't afford to pay for monthly premiums and you're choosing to go uninsured at that point, or you feel like you really have to go uninsured at that point, then you would want to apply for a certificate of exemption from the marketplace to show that you shouldn't be responsible for buying insurance.
Here's another question, Cheryl. What if you're on Medicare now? How does that work?
Medicare is the same as it's always been. You don't really need to do anything. You can stay on Medicare. Okay.
And then somebody else is asking is, what is the poverty level?
That was back on an earlier slide. Let me just see whether I can quickly find it for you. Hold on one moment.
Maybe I can get back to it.
So for one person, the poverty level is $11,490. So if you're below that amount, you'd be really looking for Medicaid. If your income was between $11,490 a year and $45,960 a year for one person, that's 4 times the poverty level, you'd be able to get premium credits. For 2 people, $15,510 is the poverty level, $62,000 and $62,040 is the maximum for premium credits. For a family of 3, $19,530 is the poverty level, $78,120 is the maximum for premium credits. And for 4 people, $23,550 is the poverty level, and $94,200 is the maximum for premium credits. Now, I just want to mention that there are a few deductions before you reach those levels that you're allowed to take. They're sort of like the deductions that you take on your tax return, on the first page of your tax return. So if you're close to those limits, you should still apply and find out whether you're eligible. The marketplace will tell you once you fill out the application.
All right. And there's going to be copies of this PowerPoint presentation on the website, on the NF Network website, in a couple of days right after the webinar, so that you can go back and refer to those numbers.
Yeah, and if you want to know the poverty level for other household sizes, if you if you Google Families USA Federal Poverty Line, you'll come to our chart that's more complete.
All right, then I'm going to go up to this next question. Lisa is asking for that website again for the exemptions. Can you say that for them, Cheryl, what the website is for them to go to find out?
Oh, so you would go to healthcare.gov, www.healthcare.gov, and that's the federal government website where you would apply for marketplace coverage, you would apply for exemptions. In some cases, they'll be directing you to the state website, but that's the starting point to find out. You can also find a ton of information on that website. It has answers to a lot of commonly asked questions. It goes over a lot of the same kind of material that I'm going over today.
Okay, and here's another question. If you have a very basic employee plan, can you go to the marketplace and get another minimal insurance to bring you to a bronze level coverage at a cost lower than getting a bronze coverage on your own?
Well, if you have a very minimal employee plan, you may just want to buy the bronze plan and not keep the employee plan. I don't know whether, if you were paying full price and not getting premium credits, you could probably get both. I'm not sure that you could really keep both otherwise. That would be a question to ask the federal call center. I'm not confident of that answer.
Okay, let's see what this one is here. So even though there is no discrimination for pre-existing conditions, we have already received information that our monthly premiums are increasing and our out-of-pocket is going from $2,000 to $7,000 per year. Is this happening with others?
Well, I'd be interested to hear what's happening to other people on the call. Sometimes as you know, health insurance prices have been increasing for a number of years. So I don't know that that is related to this law. You'd have to kind of explore that. But if your prices are going up, you should also just check on the marketplace and see whether you can get better coverage on the marketplace.
So we have a young adult asking a question here. She says, what about unemployed adults without insurance now needing health insurance?
Right, so that would be a great place for unemployed adults. Should definitely go to the marketplace and they could find out whether they're qualified for Medicaid or whether they're qualified for premium credits. They may definitely apply. They may qualify for either one. Another thing that I didn't mention is that sometimes when you're unemployed, you're offered COBRA benefits at your job, and even though those are benefits from an employer, you are free to choose between COBRA benefits and marketplace coverage. Having COBRA benefits doesn't stop you from applying and getting premium credits. You could drop the COBRA coverage and get premium credits instead. It's often cheaper.
So I have two different people asking basically the same question. Since they have doctors that they like to see all the time, they're both asking what are they going to be able to continue to see the physicians that they are currently using?
Right. So you definitely want to look at provider directories when you're shopping for a plan to make sure that your provider is in the network of the plan that you're considering. The marketplace is going to include HMOs, PPOs. In some states, a lot of insurers are offering plans. Many of the insurers that you have today will be offering plans. So you just really need to ask whether your provider is participating in the plan that you're considering. If you have insurance now that you like, you can probably renew that policy. If your insurer may be offering that still, and you could just renew it.
Okay. And here's another question. Is the poverty level based on gross income or AGI?
It's based on adjusted gross income. It's called modified adjusted gross income. It's pretty much the income figure that you see at the bottom of the first page of your tax return. It's those sorts of deductions. There are a few small modifications to that. For example, you add in the full amount of Social Security benefits, not just the untaxed amount of Social Security benefits. The marketplace will calculate it for you, but that's just sort of a rough idea.
And I see another one here. It says, our family currently has TRICARE, and our medical case manager for our son has been advising us to apply for Medicaid to help with things that TRICARE doesn't cover. Does this mean because that we have TRICARE and Medicaid, we would be denied assistance with this, that we would be denied to assist covering his medical expenses?
Well, Medicaid, if he qualifies for Medicaid, Medicaid would then cover his medical expenses in combination with TRICARE, and you probably wouldn't need to get a private plan. Medicaid is generally, Medicaid combined with TRICARE would probably cover more and at less cost to you.
Terrific. Well, Cheryl, I think we have all of the questions. I'd like to just tell everybody again that we'll be able to see these slides again up on the website in just a couple of days. And I'd like to thank you, Cheryl, for giving up your time this evening to bring this information to our families with neurofibromatosis, and to Katie for getting us connected with Cheryl. We really appreciate it, and for giving your evening tonight.
Sure, thank you. And I just want to mention one other thing, which is that Families USA, which is familiesusa.org, keeps stories, both bad and good, about the healthcare system. So if you go in the marketplace and love it, we'd like to hear your story. If you go in the marketplace or even if you don't go in the marketplace, if you're having a problem with insurance today and you want to share your story, we'd love to hear it. We try to connect reporters with people who want to tell their stories, so please let us know if you have one.
Well, thank you, Cheryl. Good point. Good point. And I believe you put your website on that PowerPoint presentation, didn't you?
It's familiesusa.org.
Okay.
All one word.
All right. Well, thank you, everybody, and have a good evening.
Thank you.
Bye-bye.
Bye-bye.